I've been looking for a setup that supposedly automatically recording, but apparently I have to manually do that. Yeah, Eric was asking a great question about assignment. So it's about your disease presentation assignment. Yeah. So I moved that up here. It was down there. Now I have a quick question though. So this is all, the bottom is Mind tab. And there is a final exam. I was wondering, do you guys want to skip final exam? Because your Mind tab is already a lot of questions. So tell me if you want final exam or you don't need, make a note. Put that in the chat. I think by doing homework from Mind tab, that should be enough. There's also each quiz on each chapter. And this class is pretty short. And you have this disease presentation. So I'm going to check in the chat. Unless you insist to have final theory exam, that's what I meant, final theory exam. So what do you guys think? Do you want still this final theory exam? Oh, July 13. No, I have to change this. It has to be open a week. So this class ends August 21st, am I correct? So due date has to be August, wait, yeah, 24th. And then available from now and until August 26th. Okay. Oh, no. Available from a week before. So what do you guys think? Do you understand the questions? Maybe starting 23rd midnight. Yeah. That has to be PM. What am I doing now? All right. There you go. Yeah. All right. Can you guys hear me? Can you guys say something? I don't hear anybody say anything.
It's mostly in the chat, but the consensus is to not take the exam, but probably keep it on like as a practice test, maybe.
Oh, yeah, sure. I'll just post it, practice, and it will not be graded. It's good for you too. Oh, someone said, yes, final. I'm kidding. Not even one. Not even one wants that, huh? But I also was thinking, it has to be feasible, right? So yes, that's a great idea. Who's that? Who just said that? Is that David or Eric?
It was me,
Who's the me?
Daniel.
Oh, Daniel. Yeah, you like to come up with a great idea. Good, good. So yeah. So before I forget, I'm gonna just put the proportion of your grading system. Yeah, I'm going to change it. So I'm gonna do here assignment group weight. Okay, wait a second, because I will forget later. So final exam 0, yeah. So you guys I will still put it in there. So I'm going to increase that attendance 20, disease presentation, maybe 35, wait, 40, 40. Is that making sense? Is that good? Is that fair, guys? What do you guys think? Oh, do you guys see what I'm seeing though? Yeah. Yeah, so attendance 20, or do you think 30? This is presentation 40. Mind tap is, there's a lot mind tap. So maybe mind tap 50, right? And this is presentation 30. What do you guys think?
I
Any?
don't know about everyone else, but can we have the disease presentation be a little bit more than the mind tap?
You're right, there's a lot of work, huh? So 40, 40 then. So equals with the mind tap, correct? Like this?
I mean, I don't speak for everybody. I want other people
No,
to
no, no.
respond.
Yes. It has to start from one person, otherwise nobody talks. That's great, Daniel. It's a leadership skills. So chat. I would like to skip no exam. Yeah. Okay. All right. So now after you skip, I'm gonna put 0, but I will post like within 2 weeks, yeah, for you to practice, but it will not be graded. It can be added as an extra credit for sure, yeah. Even though this is non-credit, pass, no pass, you can still kind of print out or screenshot your grade that it might be beneficial, yeah, that you get A's, B's. In order to pass this class also, you have to have at least 80%. I think it's all in the syllabus, okay? Daniel, does this sound good?
Yeah, sounds good to me. I don't know if that's if
The
everyone
other
is okay with
student, huh?
the weight of the disease presentation and mind tap assignments. I think usually people get pretty good grades on the mind tap assignments, so I think they would prefer for it to be a little bit higher. Maybe we can do like a 45% for the mind tap and then 35 for disease presentation.
Yeah, that's so everything from you, by you, and for you guys. Yeah, Abraham Lincoln, right? Um, the address of Gettysburg. So I love that idea. So that looks good. Or attendance we increase, or that's good. All right. Finally, someone's talking here. Oh, Ashley said sounds good. Awesome. All right. You guys want to put thumbs up? We need a majority vote. Shiva, what do you think?
I think that's good. I agree with.
Awesome. Yeah, David. So we got 3 now. David, what do you think?
I also agree.
Awesome. 4. Sitlali, we need at least 5 or 6. Sitlali, is that good?
Yes.
Awesome. 2 more. Ashley. Oh, Ashley, you already said that. Daniel, yes. Lillian, is this good enough?
Yeah, seems good to me.
Ogler?
Yeah.
Okay. Ogler, is it good?
Yeah.
Awesome. Awesome. Yeah, I think it's already comprehensive enough for you to do mind tap. I'm looking here, there's a lot that you have to do, so we can skip the final exam, but I still will put it on and maybe 3 attempts. So you guys, it's gonna open on what? Oh yeah, on August 23. I'll open it earlier than that. Do you want to open? When is this class end? 21st, am I correct? Anybody can tell me? Otherwise, I just open here. So this class end on all right. We should see that in syllabus. I have so many class that I teach, so I apologize, guys, for the inconvenience. All right. Oh, August 17. All right. So I will open the final exam now. Maybe earlier than that, and I'll open up for a week, guys. Even though class ends the week of 17, I will open all the way to end of August, so you guys can look at it. Yeah. I have to submit grades a week after, or whenever it's due. Mostly I do the last minutes to give student more opportunity. So wait a second. Inix mom is teaching online. Just do the better one. Oh, that's fine. Yeah, if you already did that. Yes, my love. Oh, yeah, whatever. All right, bye. Yeah, that's my son. So I'll open August 10, yeah? And I will give you, it will not be graded. That will be 100 question. If you want more, I can give more. Because I have the test bank from the textbook, yeah? Allow multiple attempts. Okay, and then your scores probably average, and then allow attempts 4 times. And once after each attempt, you will get the answer. All right. Available from, so I gotta change that. I said 11, right? Yeah. And then I open up until end of the month. So you guys have something. Unlock date cannot be after due date. Oh, yeah, due date will be 31st. All right, got it. Okie dokie. All right. Let's see what chapter are we at now. Maybe look at the modules. So everybody doing good on assignment? Easy peasy, making cheesy lemon squeezy, yeah. All right. We are, I believe 1, 2, 3, 4, 5, 6. We have to finish 7, 8, 9. That will be due this weekend, correct? So 7, what is that 7? What body part is 7, guys? It's funny how it doesn't say in here. Huh? Doesn't say, that's weird. Let's see assignments. All right, before we continue chapter 7, 8, 9, any questions from anybody about anything?
Yeah, I have a question.
Of course. Who's that?
Shiva.
Oh, hi, Shiva.
Hi.
Hi.
So I was doing the assignments and there was 2 of them that were not popping up. It would just become like a black screen. I don't know if anyone else had that issue. I haven't had any issues with the assignments not popping up as far besides this lately. I screenshotted it on my computer so I can send it to you.
Yeah.
I don't know like what else to do. So there's 2 assignments I couldn't do.
Yeah. You know, we have to be fair in everything, and I just trust what you said. Go ahead, email me,
Okay.
and then I just put excuse, so it will not add up your grade, but it will not go against you. Okay?
Okay. Okay.
Yeah.
Thank you. I'll send it to you.
Ashley, thank you so much. Attendance. You know, I'm gonna do attendance in the middle, because I think I noticed some students after attendance they disappeared. Yeah, so maybe I do at the end. Is that okay? All right. That means okay. Okay. What I'll do is I don't even know what I'm doing. Oh, okay. I guess I know now. All right. What is chapter 7, guys? What's the title? So last one we did, I think immunology, correct? Lymphatic system. So now we're in chapter 7. We already did cardiovascular. All right, respiratory system. All right, cool. Okay. Any question from chapter 1 to 6? Anybody from anybody? You know, I just cannot teach any detail. That's why we're gonna do female this time. We've been doing male. Yeah, it's very short class, and also you have mind tap. So that's how good mind tap is, that help you study a little bit more comprehensive. Okay, we're gonna start from Eric. I'm going to share the
First time I know that work again. And I'm on my phone, so I don't know if it'll answer the questions.
what, Eric? You're muted, Eric. What did you say? Yeah, but I see here that I cannot share mouse to you. You maybe use a cell phone or iPad. So I'm gonna start with Natalie David. Yeah, so everybody will get their. Okay, got it. All right, that should be okay. Natalie, go ahead.
Oh, can you hear me?
Do you get the mouse?
Uh,
Oh wait, give me the mouse. I think it's a wrong tab. Yeah, there you go. You got it?
oh yeah, I think so. Oh, should I read it out loud?
Yeah, would be nice. And then ask your friends to give yeah, opinion or answer.
An excessive discharge of mucus from the bronchi is known as, I think it's bronchorrhea.
Everybody agree? Good. Suffix "ria" means excessive discharge, yeah? What do you call runny nose?
Is it rhinorrhea?
Yes, good job. Awesome.
The incomplete expansion of part or all of the lung due to a blockage of the air passages or a pneumothorax is called. I'm assuming it's the first one, because asbestos is something else.
Good. What about asphyxia?
That one is like being asphyxiated, like suffocated, I think.
When object goes to the wrong tube, yeah, instead of go to the stomach, they go to the respiratory tract. So yes, atelectasis is the answer. Good job.
The loss of the ability of the larynx to produce normal speech sounds is called phonia.
Yep, phone is sound, and A, yeah, prefix A always mean absence or loss. Yeah, good.
Bradypnea is an abnormally slow rate of respiration, usually less than euthnia, because that means normal breathing.
Yeah, this is typo. The right answer supposedly upnea, I believe. Maybe this is the typo one, but yes, yeah. So this is typo. The answer. Let me give a little bit note. Yeah, give me the mouse. Yeah, give me the mouse. Don't touch the mouse. Yeah. Yeah, this is typo. Yeah. So let's do vital signs. Yeah, this is very vital. Everybody need to know. Okay. So respiratory rate, what is the normal range? 12 to 20 per minute, right? So when we have less than 12, we call bradypnea, yeah? Or some textbook also they call bradypnea. That's fine. That's also correct, yeah? Either pnea or pneu. So eupnea. So that means normal range, yeah? So this is eupnea. Yeah, go ahead. You guys can do screenshot and contact Cengage. They give you free textbook. But of course you have to give like maybe at least 10 typo that they have in MindTap or textbook. I already have 5 students get free textbook because I encourage them to contact MindTap with this because you help them review their textbook and material. Yeah. So eupnea is the normal range, yeah. And then if it's above 20, what do we call? Tachypnea, yeah, or tachypnea. Okay. I'm gonna do there. All right, so now pulse or heart rate, yeah. What is the normal range, everybody? So we're going to make a note about medical terminology of vital signs, yeah? So heart rate, what's the normal range, everybody? 60 to 100, yeah, per minute, okay? And if it's less than 60, what do you guys call? Bradycardia, yeah. Above 100, what do you call? Tachycardia, yeah. And also heart rate, there's a word NSR. What is that? NSR. So that's not talking about frequency. So when we said 60 to 100 per minute, that's talking about frequency, right? We also talk about the rhythm, yeah? NSR is, if the rhythm is regular, yeah? That's regular rhythm, yeah? So that's what we call NSR, normal sinus rhythm, yeah? If irregular rhythm, Yeah, that's what we call arrhythmia. Yeah, wait, rhythm. Yeah, so that's irregular beat. Yeah, irregular rhythm, or we also call dysrhythmia. Okay, so all right, TPR. So temperature, guys, what's the normal range? Everybody? So it's like 98, wait, 90, 98 or 96, wait, or 90? Yeah, I think 90 point, yeah. Different textbook they mentioned. So again, this is for adult, not children. Yeah, adult normal size. To kind of like 99 point. Wait, not, I think 97, sorry. Yeah, 97 point something, yeah, to 99 point something, something, yeah. Now, anybody know subfebrile? What is subfebrile? That's kind of around 100 to 101, yeah, or 99.9 something, yeah. Different textbook has different, and this is in Fahrenheit, centigrade. Okay. Now, if less than normal range, what do we call? Hypothermia. Yeah. There's more detail than that, but we just do the general. Okay. For the sake of time. So if above normal range, what do we call? Hyperthermia. Yeah. Blood pressure. What's the normal range, guys? 2-3 years ago changed. Yeah. So we're gonna put as AHA. I think they changed it in 2022 or 23. I think 22. Yeah. Up until now, I don't think they have changed since then. Yeah. Used to be normal high 140 over 90. They put it down to 130 over 80, I believe. Yeah. So we go 90. So the range is per 60 millimeter mercury. Yeah. Through 130 over 80 millimeter mercury. Yeah. Now, if it's above 130 over 80, what do we call? Hypertension. Yeah, that's a legit abbreviation that you can write in patient's chart. Okay, just put HTN. That means hypertension. Okay, less than 90 over 60 millimeter mercury. That's what we call hypotension. Okay. Now there's one more important thing in blood pressure. So when they are between 121 over 81 to 130. No. Sorry. I meant 91 over 61. Sorry. Because 90 over 60 is the normal low. Yeah. Once they go up, 1, yeah, 90, 60 to 130 over 80. What's that called, guys? It's called pre-hypertension. Yeah. Why is it important? It's important for someone with diabetes. So when we have a patient with diabetes and they are under pre-hypertension, then the range of their blood pressure yeah, in millimeter mercury, then doctor will need to prescribe anti-hypertension medication to patient. But if you don't have diabetes, you don't need that medication. Is that making sense? Questions? No? Okay. All right, Natalie, go for it. Continue.
Which of the following are very small grape-like clusters found at the end of each bronchial alveoli?
Mm-hmm. If it's one alveolus, yeah, if plural is alveoli. Good job. So that's important. That's where the gas exchange happen. And also another thing is, it's kind of like balloon, yeah. That's where gas exchange oxygen, carbon dioxide. And someone with emphysema, asthma, COPD, right? It has to be balanced what the air in and out. So patient with that, the air in more than the air out. So they get bloated, they get engorged, and then that's what create, if you see patient with long chronic COPD, they look like a barrel. That's what called barrel chest. Yeah. So alveoli is very important. Also, when the baby's born, sometimes we need that enzyme surfactant. When it's not available, then the alveoli will not be open up to contain the gas, and it can be life-threatening. All right. Good.
Collection of pus in the body cavity is referred to as.
Natalie, you're doing great.
Shortness of breath or difficult or labored breathing is known as.
Awesome. Yeah,
A-
this means painful, difficult. Yeah.
A nosebleed, bleeding from the nose that may be caused by dry air and injury. Medication to prevent blood clotting or high blood pressure is also known as epistaxis.
Yeah, epistaxis. Good job.
The condition of having low oxygen levels in the blood, usually due to respiratory disorders or heart conditions, is known as. It's hypoxia.
So either hypoxia or hypoxemia, what's the difference? So if they say in the blood, do you have to add emia or not?
Oh, I think you do, because anemia means blood.
In the blood. Hypoxia is oxygen. Ia is pertaining to hypo, lack of oxygen in the cell. But if it's in the blood, that is hypoxemia. Yeah, good job. All right, good.
Hypercapnia is the abnormal buildup of blood in carbon dioxide.
Yes, carbon dioxide. Good. And then it can cause patient disoriented. So patient can look like crazy. Yeah. So don't just jump into patient having mental problem. It could happen also patient with a long term of CPAP, sleep apnea. And then there's a time that the machine cannot help anymore. So there's no changing. And then build up that carbon dioxide in the blood. Yeah. So that's when doctor need to do ABG, right? Arterial blood gas. We gotta puncture the radial artery, not the vein. Yeah, and then to check that arterial blood gas. Good job.
The middle section of the chest cavity located between the lungs is known as the medius. tachypnea is an abnormal rapid rate of respiration more than 20.
Oh, we learned that. Good job.
Any fibrosis of the lung tissues caused by dust in the lungs after prolonged environmental or occupational contact is called
Yeah. Huh? It happens a lot for people working on the street, yeah. Exposed to dust, handyman. People work hard. Good job. Pneumoconiosis.
a surgical incision of the chest wall to open the pleural cavity for biopsy or treatment is called
What is, okay, good, yeah. Thoracotomy. Otomy, surgical incision. Good job.
the sharp pain that occurs when the inflamed membranes rub against each other. With each inhalation is called
Good. So that's a plural, yeah? Plural kind of rubbing because there's no liquid in between. Pleurodynia. Good job. Yay! Oh, oh, that's typo, right? That's the eupnea, correct? All right. So next will be, yeah, give me the mouse. Yeah, don't touch the mouse. Okay. All right. I'm going to share to Lillian, yeah? All right, Lillian, do you get that? All right.
Yeah.
Awesome.
Okay. Okay. Do I press continue?
Mm-hmm. Yeah.
Okay.
Ah, you're here. I'm Lorinda Hollander, the head nurse in pulmonology, and your report to me today. You're up in your respiratory system terms, right? I believe so. That's reassuring. Well, we're short-staffed today, so you're going to be very useful, I hope. We've got some x-rays that need to be labeled for a presentation that we're doing this week. So if you could just mark the part of the x-ray that the notes are referring to, that'd be a good start. Should have everything you need, okay? You got it. Let me know when you're done. Got a lot of work for you.
Right.
Do I read the clinical information?
Yeah, just start from complaints of
Okay. Complaints of repeated heavy epistaxis.
epistaxis.
Findings, no evidence of tumors or significant variations in contour or structure. Anterior cranial fossa normal, maxillary ethmoid and sphenoid within normal limits.
Yeah, sphenoid. So, yeah.
Oh, I have to find the.
So it's silent, the next consonant, right?
Yeah.
Good.
Well, they're complaining about that's nosebleed, right?
Yeah, I was about to
So is
tell.
that where the X-ray would be?
Yeah, anything cover the.
Okay. Am I supposed to choose more than one?
No, only one.
Or just that, like that?
Yeah.
Okay.
Anything cover the nose, right? Good
Got
job.
it.
Yeah.
Okay. Findings, there's no pleural effusion. There is slight atelectasis
Atelectasis, yeah.
Atelectasis.
Atelectasis,
Okay.
yeah.
Cardiac and aortic contours are within normal limits. No cardiomegaly, normal spinal vertebrae and rib structures.
Yeah, it's a little bit syllable pronunciation from English, yeah, because it's Latin. So that makes sense. Oh, what did I do? Am I okay? Oh, do you still see the, okay. Oh, it's funny that my screen, okay, let me stop share first. All of a sudden it's gone. Okay. All right, you still have remote control, Lillian? Okay, go for it.
Think so?
Yeah, I accidentally click on something.
Yeah.
I need to clean up my keyboard and yeah, go for it.
This one I'm not really sure. I don't know what.
Pleural effusion, what is that happening? Is that,
And the
yeah, that's a
lung.
thoracic cavity, right?
Mm-hmm. Clinical information, sudden aphonia that has been present for the last 3 weeks. Findings, CT shows orbits, paranasal sinuses, nasopharynx, oropharynx, and tissues surrounding
Laryngopharynx.
laryngopharynx to be within
Yeah,
normal limits.
new language, huh?
Yeah. Without any tumors or variations in contour. 5 mm lesions noted on superior aspect of right vocal cord. No evidence of any other lesions present in surrounding tissues. I don't know if that's correct.
Oh, sorry, I'm answering email. So what's the question? So paranasal, sinus, nasopharynx. Okay, let me give a little bit guidance, yeah. So orbits, this is the orbit. Oh, gotta change the color. Yeah, I have a meeting in the morning. Okay, email sent. Okay, so orbits is this, yeah, eye socket, correct? So that's the orbits, and then paranasal sinus, right? So we have sinuses, so somewhere around, so this is nasal, you see that? Yeah, nasal cavity. So paranasal is around the nasal. And pharynx is basically right behind the nose. You see that the nose here, there is something digestive and respiratory tract. Yeah, they get separate by the epiglottis. Okay, so right behind the nasal, that's the nasopharynx. Yeah, which is this. Yeah, nasopharynx, basically pharynx or throat behind the nasal cavity. So if you right behind, yeah. And then we have mouth, oral cavity. So right behind that, so we have kind of like pharynx over here. Yeah, pharynx. Oh, maybe different color. So we have pharynx right here. Yeah. It could be related to so the same tunnel go to the respiratory tract and digestive tract. They will be separated after epiglottis, okay? So this is the pharynx, okay? Right behind nasal, that's nasopharynx. Right behind mouth, That's oropharynx. Yeah, so there's three components or three location of pharynx. And then right behind the vocal cord, laryngopharynx. Okay. So oro and then laryngopharynx. So you're gonna aim somewhere around here. Make sense?
Yeah.
Yeah. All right, go for it. Good, good.
No. Okay.
Yeah, it's I like how you're thinking. It's supposed to be combination top and bottom. This is
Yeah.
because this does not cover laryngopharynx.
Oh, yeah.
That's for sure not. But that's only the jaw. Yeah, so you're right. It's confusing. So
Mhm.
that's another thing you can report to Cengage to get free textbook, guys. Yeah. And that's for real. Oh, yeah, you're right. So, but that covers orbits. So they want the bottom one. Yeah.
This
That
one?
yeah, because that will cover. But yeah, you can report this to Cengage. So for this one, that cover over there, nasopharynx, oropharynx, and then here laryngopharynx. This is the pharynx. But also it has orbits, right? So it has to be a little bit top here, supposedly like that. So that's what you're gonna tell Cengage. Okay?
Okay.
Yeah, so I get what you're saying.
All done with the x-rays? Yep, all set. Great. I have something else for you then. Here's a set of patient examination records. I need you to go through them and correct any spelling errors that you see. A former employee who was recently let go prepared them. It will soon be obvious why once you see how blatant some of the typos are. Anyway, enough about that. I'll let you get to it. Come grab me when you're done.
Oh, yeah, I'm gonna change the person, yeah. So everybody get Daniel, go for it, Daniel. Yeah, so everybody get their turn.
Okay. Epi. This.
So when it says epistaxis X3, X means duration. That means 3 times patient experience epistaxis. Yeah. So that's good to know. Medical term at sub symbol that they write in patient's chart. Yeah, I'll be back, guys. I'm hot. I need to run. So what are they trying to say that? Remember, Natalie, between hypoxia and hypoxemia. Yeah, I think they confuse us with hyperoxemia. Is there a
So-
word hyperoxemia?
I think so.
Oh,
Wait,
okay.
so what is this supposed to be?
Could be hypoxemia, meaning lack of oxygen. Ox is oxygen.
Like hypo like this?
If hyper could be hyperoxia, yeah, but hyperoxemia, I rarely hear that. So I could be wrong. Yeah, so it could be hypoxemia. Hypercapnia is pretty common. Yeah. High carbon dioxide in the blood. Try that. If it's not, then hyperoxia. Ah, good job. Awesome. So hypoxemia. Yeah. So either hypoxemia or hyperoxia. There is no hyperoxemia. Yeah.
I thought there is though. But
There
it-
is hyperoxemia. You could be right. Yeah. Let me check. Yeah. I rarely hear that in the clinic though. But could be. You never know. Yeah. Can everybody check? I'm checking hyperoxemia, right? Ah, you're right. There is hyperoxemia. But you type hyperoxemia, they mark wrong, huh? There is hyperoxemia. Yeah. So high oxygen in the blood, hyperoxemia, high carbon dioxide in the blood, hypercapnia, high oxygen in the cell, hyperoxia, low oxygen in the cell, hypoxia. Yeah. So what is that wrong?
bronchoria.
Oh, bronchoria.
Oh, missing
Yeah,
H.
missing H. Yeah. Good. Awesome. Yay.
Thoracotomy.
So we're do surgical incision, yeah, in the thorax in between your ribs. That's pretty common. I used to have patient with I think severe pneumonia, and they have a lot of mucus in their lungs, yeah. And then very thick, yellowish and greenish. Oh my goodness. When we do the thoracotomy, yeah, so you're gonna make a cut to the side here, and you drain that. You drain that mucus, thick mucus, pretty smelly. But after that, patient feels so so good. Patient feel so that's thoracotomy.
Oh, thoracotomy.
Yeah, from thorax and otomy. Yeah. And patient feels so relieved, can breathe. Can you imagine that thick mucus filled up your lungs? Yeah. So that's what the thoracotomy process. All right.
Oh, good, you're back from lunch. Looks like a lot of patients called with questions while you were out. Listen to each message and clarify any confusing medical terms for the patients. If you get stuck, feel free to ask for help.
Yeah, we're gonna move to Sitlali. Sitlali, go ahead. Take over the mouse. All right, go for it, Sitlali. Click next. Oh,
Oh, good, you're back from lunch. Looks like a lot of patients called with questions while you were out. Listen to each message and clarify any confusing medical terms for the patients. If you get stuck, feel free to ask for help.
Yeah, and the patient that I mentioned, pneumonia, pretty young girl, woman.
My son is a medical student, and he has a few questions that I can't answer about my condition. Could someone please call me back with the answers to these questions? First, my son wants to know if I was experiencing any dyspnea or tachypnea. He asked if I was experiencing any epistaxis, but I don't know what that is. He also wants to know whether you noted any bronchorrhea and whether you suspect hypoxemia. I don't know what any of this stuff means, so I'd appreciate it if you could explain it all to me when you call me back. Thanks.
Why didn't he just ask his son going to medical school, huh? That's funny. Okay. Nobody laughed, that's fine. Hmm? What is this? Everybody? So that will be bradypnea. So you see that dyspnea, pnea is breathing. This means painful, difficult, not swallowing. Yes. So painful swallowing is dysphagia. Yeah. Awesome. Good job. Tachypnea. Yeah, if it's above hundreds, rapid heart rate. Oh, wait. Tachypnea. Oh, rapid rate of respiration. I am so sorry. I was wrong. Yeah. So sorry. I did not really pay attention. So everybody, what's epistaxis? Yay, good job. Got it. Good job. Awesome.
I was in your office last week for a follow-up visit, and I've been doing some research online. One of the websites I visited said that common complications following a thoracotomy are pain in the mediastinum, sclerodemia, and atelectasis. I don't know what any of these terms mean, and I was hoping you could tell me what they are so I know what to look out for. Also, I was told that I have empyema, but I'm not quite sure what that means.
Good. Yeah, that's also can be for biopsy, other than draining those mucus, yeah. Awesome. That's where your heart located between both of your lungs. Yeah, that's mediastinum. Good job. So this is opposite emphysema. Yeah, emphysema, your alveoli, it's your lung is bloated. This one in partial, incomplete expansion. Yeah, they don't has to be expanded like this, but they cannot just incomplete or partial expansion. Yeah, good job.
My son was in the office earlier today for a follow-up visit. Our regular doctor asked me to follow up on several of his symptoms. I forgot to ask while I was in there. I'm not sure what any of these words mean, but he wanted to know if you noted any aphonia, pain in the mediastinum, or pleurodynia. If you could tell me what these terms mean when you call me back, I would be eternally grateful. Sometimes our doctor just seems to be speaking a different language.
This is very painful, guys. Yeah, pretty painful. Sharp pain. Good. Awesome.
I was in the office last week on a referral from my regular physician. The paperwork said I was being referred for an evaluation of alveoli function with possible hypercapnia due to pneumokinesis. He did several tests while I was there and said he would send the result to my regular doctor, but my appointment with him isn't until next week. I was hoping you could explain what you were looking for and what you found. The only thing the doctor told me was that you didn't note any pleurodynia or breath apnea. It all sounds so serious, and I was hoping you could put my mind at ease while I wait for the appointment with my regular doctor.
I'm not sure if you're reading the questions, Lali. You've been muted though. Yeah, good job. Seems like a lot question. Let's give to Ogler, yeah? Yeah, if you guys don't want to read, it's fine. Just answer it, it's fine. You guys hiding in your cave, that's fine, yeah. Okay, Ogler, go ahead, continue the answer.
Okay. I have to read that question.
You can do like Sitlali or you read question, whatever convenient for you, yeah?
Okay.
Mhm.
What does the hypersthemia mean?
Mhm. So this can cause disoriented. They look like crazy person because so much carbon dioxide in the blood, yeah?
I think it's the C, but I can't click on it.
Oh, I'll help you. Okay. Are you using iPad? Sometimes it's hard to move the mouse with iPad.
Here we go.
Yeah, just let me know and I'll help.
I can still click on the.
Oh, maybe I have not shared the remote. So wait a second. Yeah, it could be. Ogler. Yeah. Thank you for letting me know. So sorry. All right. No.
No, that's not.
Yeah. No, that's wrong.
Oh,
That's
that
not
was.
it. Yeah. Difficult breathing is dyspnea. This is pneumoconiosis.
Oh, it's the other. What is this? opinion.
Yeah, that's one. Good job.
Um,
The first one. Yeah. Yeah. People that work repairing the road, making the road. Yeah, most of them get this, or working with a lot of dust in the lungs. Yeah. Good.
what is
Fluorodynia. Fluorodynia. Good. Awesome. Yeah.
I think it's this.
Mm-hmm. Good.
What is bradypnea?
No, that's not. So that is oh yeah, bradypnea. You're right. I don't know why I read as if dyspnea. Good job. You're right. Yeah, sometimes you don't listen to your teacher, huh?
I'm impressed with the way you handled those calls. You're pretty good at this, you know. I get a lot of people coming in here who just don't have a basic grasp of respiratory system terms, and it can be a real struggle for them. But you know what you're doing, and you should be proud of that. It's not easy. Anyway, thank you for all of your help today. Next time I need someone, I hope they send you. Have a good night.
You're hired. All right, so next, David. Go for it, David. And I will ask some question and maybe a little bit give you some extra, yeah? All right, click continue, David. Wow, David, awesome. Do you want to read that, David?
Read it? Okay.
Yeah, thank you.
When pus is collected in a body cavity is called, I'm pretty sure this one,
Emphysema.
emphysema.
Yes, good.
When the body has low oxygen levels in the blood, usually due to respiratory disorders or heart conditions, the condition will result in
Good. Hypoxemia. Yeah.
hypoxemia.
Yeah.
Fibrosis of the lung tissues can be caused by dust in the lungs after prolonged environmental or occupational contact. What is the medical term for this condition?
Mm-hmm. It also happened to miners, yeah, in the past. Lots of them died earlier. It's called black lungs too, yeah, because the dust is a different, it's kind of like different kind of dust. And government up until now pay for that, yeah. So if people get that black lung due to environmental related disease. Good. Which is called pneumoconiosis.
Hypercapnia is the abnormal buildup of blank in the blood. I'm pretty sure it's carbon dioxide.
Awesome.
The incomplete expansion or or all of the lung due to a blockage of the air passages or a pneumothorax is known as. Is it
Mhm.
this one?
Awesome.
This is the middle section of the chest cavity located between the lungs.
Yeah, mediastinum. Yeah, that's where your heart located at.
Mm.
Mhm.
When a person's larynx has a loss in the ability to produce normal speech sounds, this condition will occur, and that is aphonia.
Sometimes it happened to the singers, hard rock singers. They yell, sing loud so long, and all of a sudden they cannot speak. Yeah, pretty common because there's a swollen in their vocal cord, and wait until it get healed, then they can talk again. Yeah, that's aphonia.
If a person experiences labored breathing, the condition is called dyspnea.
Mhm.
An abnormally rapid rate of respiration is referred to as tachypnea.
Awesome. Why do you guys take this class? You guys already know all the answers.
Uh, this condition is known as blank. It occurs when the inflamed membranes rub against each other, with each inhalation causing a sharp pain. And it's this one, pleurodynia.
Pleurodynia. Good.
Also known as a nosebleed, this condition is recognized by symptoms of bleeding from the nose that may be caused by dry air, an injury, medication, or medication to prevent blood clotting, or high blood pressure. And that's epistaxis.
So when you see people with epistaxis, you're gonna think about this, right? Remember during summer, or you guys being exposed for long term in the dry air, California, yeah, outdoor, all of a sudden your kids, or when you were kids, you get this epistaxis. So you guys know why, right? Or injury, and also excessive blood thinner, right?
The very small great blood clusters found at the end of each bronchiole is known as the alveoli.
Awesome. All right, 100%, right? Yay.
Oh,
Oh, what happened? What's that, number 11? I don't remember. Do you remember, David?
let's go
Oh,
back.
you can go back. Yeah, good. I never thought that you can. That's good to know.
Oh, we didn't
Oh,
answer.
it's not being answered. Can you still click on that?
Yeah, bradypnea is recognized as this one,
Ah,
abnormally slow rate of respiration.
there you go. Then you get 100%. Oh, oh, that's good. You can recheck. Awesome. Yay. Awesome. Okay, what does it say? The meaning of medical terms, X-ray. Okay. All right. Any question about your respiratory system? So you got two lungs here, yeah? Okay, like that. Okay. All right. So what is this room between two lungs where your heart is? What's that called?
The
Start with the letter
mediastinum.
F. Yes, mediastinum. Now, how many lobes in your left lungs compared with the right lungs? One of them 3 lobes. Yeah, lobes. One of them 2 lobes. Which part of your lungs has 2 lobes? Anybody? And then you have your heart here, right? And then the apex go toward the left. There you go. Yeah. So which one is 2 lobes? Which one is 3 lobes? Is that left or right? So right lung, how many lobes?
I'm gonna guess and say the right one has 3.
The right one or left?
The right.
Yes. So why is it the left one get 2? So if you see that heart, it's kind of squeezed. Yeah. They have to give extra space for the heart, right? The left side of the mediastinum. This is your mid, right? This is your midline, yeah? When we do sagittal, separate left and right, correct? So this is midline, okay? Now you see there's more area of the heart moved toward to the left. So this one has only 2 lobes. And then kind of a little bit smaller than the right one. Yeah. Good answer. Now, anybody can tell me what is pneumothorax? Since we learned a little bit about pathology, yeah. What is pneumothorax, guys? What is pneumo? Pneumo, what is pneumo?
Is it air?
Yes, air or breathing, yeah. Now, pneumothorax, so say someone get, so someone get accident, probably falling from the high place down and then passing the glass, and then the glass broken, and then something punctured to the lungs. What do you think will happen when something punctured to the lungs? What is inside the lungs? So when you do percussion, right? When you percussion in your heart, you can feel that sound of filled and thick, right? But when you do percussion, tapping on your lungs area, right? It feels like hollow, like lots of air, yeah? So have you seen like chicken lungs or beef lungs, right? They are very soft and kind of rubbery, and basically it's a container for air, right? So it's filled with air. Let's see the respiratory tract from first. So we inhale air through our nose, correct? And then from our nose, we go to pharynx. We go pharynx, right? And then the pharynx area right behind your nose, nasopharynx, right behind your oral cavity. So pharynx behind your nasal cavity, nasopharynx, oral cavity, oropharynx, and behind your vocal cord, which is your larynx area, right? That's or Adam's apple. That's the larynx area, laryngopharynx. So we have pharynx. Now from pharynx go down. So and then we have epiglottis, right? Amazingly, when you eat, the epiglottis will close the pipe into your lungs, right? Automatically, you don't even have to tell them. Yeah. That's when you get choked when you're talking and all of a sudden the food wanted to go to the respiratory tract. Now, after your pharynx, where does it go? So, and then you have pharynx, larynx, and then you go tray, windpipe. What's that windpipe? Your trachea. Yeah, trachea is like this, right? And when you cannot breathe, or someone with sleep apnea, yeah, sleep apnea only because of the obesity, severe obesity, many times they become sleep apnea. They cannot breathe. The anatomical shape of your respiratory tract cannot accommodate the breathe in and breathe out of oxygen and carbon dioxide. So we have to cut that thorax, the trachea, and then let people breathe. Have you ever seen people with tracheectomy? Everybody? Yeah. Now after the trachea, you're gonna get to bronchus, right? And then you get right and left bronchus. And then from bronchus, you get smaller to bronchioles, right? And then the terminal, that's when you got your alveoli. It's a grape shape, right? That's where external respiration happening. External respiration means gas exchange, oxygen, carbon dioxide, right? So basically, this lungs is filled with air, yeah, from the inside alveoli. So end up alveoli is all over, and imagine three-dimensional, okay? So again, what happened if you get puncture like this? So it's just like, imagine balloon, right? So there's a balloon and then you puncture. What happened with the air? The air trying to move out, right? Make sense? And then you have to have balanced pressure. You don't want these lungs get collapsed. Yeah. So that's why when someone puncture with knife, the lungs, do not pull it, right? If you pull, the air will come out through the hole from that knife, and then it will collapse, and then patient having dyspnea and apnea, yeah, and then that can be dangerous, okay? What you will do is you're gonna put something in another tube to maintain in and out air balance, so it will prevent the collapse of the lungs. Yeah, so that's what called pneumothorax. Yeah. All right. So I think that's what I see that in the question, the word pneumothorax. Yeah. And if there's blood, that's what we call hemothorax. Yeah. All right. So that's chapter 7. Any questions? Was being slow. Oh yeah, that's okay. Oh yes, Itlali, you are multitask mom. I am proud of you. Yeah. All right. We're gonna move on to the next chapter. But do you guys have any question about lungs? So we're gonna finish half of the digestive tract. That's a chapter 8. And then we're gonna continue urinary system on Wednesday. If we can finish digestive today, that would be great, because I'm gonna give you some extra lecture for urinary system so you understand the physiology, yeah? And then after that, you can understand pathophysiology or pathogenesis of any disease, because that's the basic concept of understanding urinary system. Yeah. Let's move to digestive system now. But before that, let's probably get a little bit basic knowledge about our digestive tract, yeah? All right, can you guys see what I'm seeing? Yeah, I see what you're seeing now. Okay, we're going to lay out probably a landscape. There you go. Now, digestive system, yeah? I'm gonna do maybe this. So we already learned about respiratory tract system, right? From your nasal cavity, and then nasopharynx, oropharynx, laryngopharynx, and then trachea, bronchus, bronchioles, and alveoli. And then we have epiglottis that kind of close and open. For the air, go to the respiratory tract. For the food, make sure go to the digestive tract. So we're going to start from oral cavity, right? So this is your mouth, right? And then again, you can still go to the pharynx, yeah, which is your right behind your oral cavity. Yeah, so this is oral cavity. Okay, so you got oropharynx, and then from the oropharynx you go as esophagus, yeah. And then from the esophagus you go to the gastro, yeah, that's your stomach. Yeah, so this is esophagus, and then you get gaster or gastro, yeah, for your I'm gonna move a little bit down. Oh, how do I do that? Yeah. Huh? Oh wait, it doesn't move. Oh, that's weird. Maybe a little bit better. Oh, I think I draw that too big too. You know what I'm gonna do? I think portrait. Yeah, that's better. Oh, but that's okay. What am I doing? Oh, I think it's still, oh, portrait. Okay. I'm gonna delete them all. Yeah. Okay. So we have our mouth, oral cavity, right? And then we get oropharynx. And then from oropharynx, we get esophagus, right? So this is esophagus. And this is your oral cavity. Yeah. And then this is your lingua, your tongue, right? And then right down here, you have epiglottis. Yeah. That kind of separate. So your digestive tract, is that posterior to your respiratory tract or anterior? Everybody can answer that. What's that? Is that anterior or posterior? So your respiratory tract is anterior to your digestive tract. Okay. So you got esophagus, right? And then you got your stomach, gaster, yeah. Shaped like this. If you watch cowboy movie, their water container when they have to go to the desert, it's shaped like this, more likely, yeah. So you have gaster or gastro combining form, and then you have a like C shape here, yeah. So that's your duodenum, okay. So duodenum is part of your small intestines, okay. So after you eat, you masticate, and you phagote, meaning swallow it, and then get to your gaster, and then from your mouth, we have enzyme, right? And then your gaster, you have enzyme, especially for your protein. your carbohydrate, yeah, in your stomach, the fat or fatty acid is not being broken down very well yet. It has to go through duodenum, okay? So go back to duodenum. So small intestine, yeah. We have duodenum, right? And jejunum, yeah. Duodenum. And then you have jejunum, okay? And then you have ileum. Now do not get confused with, we learn in the our bones, yeah, when we learn about skeletal system, there is ileum, yeah. Yeah, that's from your pelvic bone. So that's how different it is. And they sound similar, yeah. So this is 3 aspects of small intestine, okay? So you have duodenum. Now, have you ever heard about EGD? Anybody ever heard about EGD? What's that? That's like examination radiologically, yeah. That's your endoscopy, basically, yeah. We put tubing and then go to your esophagus, go to your gaster and duodenum. That's as far as we can go, yeah. Because the jejunum here is very convoluted. We don't know where it comes and where it goes, right? So this is your, and then combine with, so that's your jejunum, right? Okay, and then this is duodenum. And we have ileum here. This is your ileum. Okay. And then ileum, we have ileocecal, and they will combine to your ascending colon. Yeah. And then you have here, you have your, what's this, guys? All right, let's back up a little bit, yeah? Okay, back up a little bit. So EGD, so this is basically endoscopy. Anybody knows what does it stand for when we call EGD? Someone has problem with their stomach, yeah, as far as esophagus, stomach, and duodenum, we do endoscopy. So EGD stand for esophageal, yeah. So that become adjective, yeah. Esophagus is a noun, so adjective esophageal, gastro, yeah. So we cover EGD, duodenoscopy, yeah. Basically duodenum, and we add oscopy. Oscopy is what is that? Chapter 1 we learned suffix oscopy, visual examination, yeah. So we put tubing that goes to esophagus, gastroduodenal, and there's a camera in the end, and you look at the monitor, and patient can go home the same day, yeah, when we perform EGD, okay. That's also called upper GI test, yeah. Oh, what did I do? Okay. So EGD is upper GI. So upper GI is like, we kind of separate into 2 segments of your digestive tract, right? So this is what upper GI, yeah. So upper GI, we perform endoscopy or esophageal gastroduodenoscopy, or barium swallow. So they swallow barium. Barium is kind of like a white chalk. and then we let patient to swallow. And once the barium is kind of milky, chalky liquid, so once it goes all the way to duodenum, then we take picture with X-ray, yeah, in case there's maybe a ulcer, yeah, somewhere around here, or in case maybe there is a tumor, yeah. There is a cancer in the esophageal, yeah, Barrett syndrome. That's due to chronic acid reflux that not being treated well. Yeah, so if you guys have acid reflux, if you have heartburn, they're all the same. Yeah, GERD, gastroesophageal reflux disease, you want to take medication. Yeah, because what happened, all the hydrochloride, they reflux. That's what give the heartburn. Yeah, to your esophageal endothelial cell inside, and then all of a sudden they change the character of the cell. Yeah, and then they become dysplasia. We already learned about dysplasia, right? And then from dysplasia they can, turn as metaplasia. Yeah, and then when they become neoplasia, neo means new, so they create a new cell. So basically they're creating a new cell that is mimicking the endothelial cell inside your gaster, inside your stomach. Yeah, because they don't want to keep being being attacked by this hydrochloride. You guys know hydrochloride, if you put in the metal, that can be melted, yeah? But thank God that God creates something in your stomach. Yeah, there's a lining inside lumen of your stomach that prevent that heartburn. But when it goes to your esophagus, that's when you feel that heartburn, right? And then all of a sudden the esophagus, oh, you know what? Let's just change our cell into similar cell of the gaster or your stomach. So that's what called Barrett syndrome. Yeah, maybe Barrett is the founder of this behavior. So when they change and become neoplasia, that's what caused cancer. So keep that in mind when you have acid reflux. So neoplasia, basically cancer. Yeah. When I work with the oncologists in Fountain Valley, we have a patient, very, very young guy. I think in high, like 48, 49, very young, handsome, and successful. And when he came, you cannot tell that he had this cancer. Yeah, it's esophageal cancer. But he had that long chronic condition of GERD, yeah, or acid reflux we call, or heartburn. They're all the same. And he was under the new medicine, yeah, clinical trial. It works wonderfully to him because he's young, and even the doctor wanted to put his case into the, all doctors, they have that group that kind of discuss who the patient and what treatment that they give, and they can create journal, yeah, finding of the clinical trial. I don't know, for whatever reason, he passed. It was so sad, yeah, and pretty young. Successful kid, is still small, but I'm kind of wondering. But I just want to give you kind of a little advice, my 10 cents. If you have acid reflux, GERD, or heartburn, you don't want to ignore that. Yeah, you want to treat that. Now, the acid reflux medication, they come with a different mechanism. Could be kind of neutralize the acid in your stomach, right? Or could be also kind of doing, you know, this area between gastro, yeah, and then your esophageal, yeah, they're getting widened. So you're gonna take medicine also to make it not widen, so they will not get into your esophagus and they will not change the structure and function of the cell that can cause cancer. All right. Now go back here. Yeah, my drawing looks so messy. Okay, we're gonna go back here again. Yeah, I'm gonna show the upper GI and lower GI. Yeah, so upper GI, we start from the mouth, esophagus. I'm gonna draw a little bit smaller. Yeah, and then we go to, I think, yeah. I think, okay. Yeah, and then our stomach, and then we have duodenum, right? And then we have this jejunum, right? And then ileum, all right? So this is the ileum, the last part. Yeah. So we have this gaster, right? We have this esophagus, and then we have this duodenum, and we have this jejunum, and this is what we got, ileum, yeah? And then we're gonna change that here. And then we're gonna have ascending colon here, yeah? And then we're gonna have transfer colon, yeah? And then we get this descending colon. And then we get, what is this, guys? That sometimes inflamed and we have to surgically remove. What's that? Appendix, yeah? So we do appendectomy, yeah? Because if you don't surgically remove this inflammation, infection, and then they get rupture, and then all of these germ, right? They get into your peritoneal area, and then when they become peritonitis, that turn into you see a lot of cascade of blood vessel here, yeah, that where we absorb that food into bloodstream and feed each cells, trillion cells. So that's the place. So when this is get ruptured, get into your peritoneal area, they become peritonitis, inflammation of the peritoneal cavity, yeah, and they can turn into, what is that, guys, when the germs get into the bloodstream? Septicemia, yeah, and septicemia is dangerous. That is life-threatening. So that's why if you have this, you don't want that rupture into your peritoneal, yeah, because you're gonna get peritonitis, septicemia, and could be death. All right. Now let's go back here. So you see this here, right? We're gonna separate into two, but not really represent that, but just for the sake of the upper GI, lower GI, because you still see that jejunum ileum there, yeah. So the top part, that's what we call upper GI, yeah. And the bottom part, that's what we call lower GI, okay. All right, so let's label these. So we have this appendix, and then so this is the ileum, and then there's a ileocecal here, yeah. So this is ileocecal, meaning it's kind of bridge between ileum and cecum of your ascending colon. That's why they call ileocecal, yeah. This is also important if you want to become a surgeon. Long time ago, if people get appendicitis, and we need to do appendectomy, we have to do laparotomy, right? We cut big. But since 20 years ago or 30 years ago, they changed. Long time ago, it's just to remove appendix. They have to cut the whole tummy, stomach, abdominal area. But now they only cut like 2 inches, right? So the doctor will cut this area here, this ileocecal. And then they're gonna put their finger and they're gonna hook that ileum and cecum, right? So ileocecal. And then they're gonna put it in the above your skin of your abdominal, right? And then by the time you hook that out, you're gonna get appendix out too. And then you put 2 clamp, and then you cut it, and then you clean it up, and then you suture it. Yeah, makes sense? So this is important, ileocecal, okay? And then you have this, the waist. So this is the area when happening absorption of the nutrients to go to the bloodstream, feed the cells. But you have a waist, right? So the waist goes from ascending colon, right? And then go to the descending transfer colon, right? And then descending colon. All right. Now, before we go to the lower GI, let's make a little note here. Okay. So upper GI, that's when we do barium swallow. They still do it now. It's been like over 50 years they perform this, which is amazing. Yeah. So patients swallow barium, and then once they go all the way covering esophagus, gaster and duodenum, yeah, then they take picture through X-ray. Remember, X-ray is only 3 colors, right? White, like milky white, gray, and black. So that's how they can determine if there's something, tumor or mass or ulcer, right? We can see from the X-ray picture. So that's one. Or we do EGD, yeah, endoscopy, or esophageal gastroduodenoscopy. Oscopy is suffix means visual examination. At the end of the tubing, there's a camera, and then as they go through esophagus and gastro, right, and then duodenum, that's when we get the picture. All right. Now lower GI. So we're gonna go back again, lower GI. So we have ascending colon, transverse colon, descending colon, and then we have sigmoid, yeah? So this is sigmoid, and then we get rectal, yeah? Or procto, yeah? And then we get anus, okay? Are we good? Any questions so far? Now, when you guys do screening for the colon cancer or sigmoid, colon sigmoid cancer, that's when we do examination, right? So the lower GI, we can do, instead of swallow the barium, yeah, that's a up or down, yeah, and then bottom up, yeah, we inject the barium through the anus. This is very uncomfortable. I've seen that patient, and I wish I will never do that. But they still do that, guys. I would prefer sigmoidoscopy or colonoscopy instead of that. But some gastroenterologists still doing it. Yeah. So instead of swallow the barium, yeah, they call barium enema. Yeah. You guys know what enema, right? So we poke that anus and then we eject, yeah, we eject those barium. Okay, so that's called barium enema. And then once that barium goes all the way up, as far as whatever you want to see that you suspect any cancer, tumor, or mass or polyp, right? So, and then you take picture, yeah, you take, so this is called barium enema. Now let's see any oscopy, visual examination. When you only want to check anus, yeah. So say someone with hemorrhoid bleeding, that's enough. You just do anoscopy, yeah. Meaning you oscopy the anus, okay? Oscopy. And if you want to go farther, you want to cover the rectal, yeah, with anus, that's what called proctoscopy, yeah. It should be all in your textbook, okay? So that's called proctoscopy. What time is it now? Oh, okay. We'll just finish this lecture and then we'll be done. Wednesday, we're gonna continue learning lab about digestive tract, and then the urinary, we're gonna give lecture about nephron. It's very important, basic, yeah, to grow from there. Now, if you go visual examination, you put that tubing with camera in the end. If you go sigmoid, then it's called sigmoidoscopy. You guys have heard all of these terms? Yeah. And if you go all the way to the colon, right? Even they go all the way to this ascending colon. This is when the doctor need to be really careful because there's in the past, and maybe new doctor, make sure doctor don't keep pushing it and then rupture here and peritonitis, septicemia, that can be life-threatening. But it's kind of like doctor has to be ladies' hands, yeah? Ladies' hands, eagle's eyes, and lion's heart. Then if you want to go all the way to colon, that's what we call colonoscopy. So all of these, anoscopy, proctoscopy, sigmoidoscopy, colonoscopy, those are lower GI, right? That's lower GI. Now, let's see one more extra here. Maybe you can do learning lab after this if you have time. What time is this class? Until 8:20 or 8:50 or what, guys? I don't remember now. But you don't get your break either. But I don't want to throw so many things and then end up you throw up with that knowledge, yeah? So, okay. So, and then we have accessories, yeah? I'm gonna clean up again and I'm gonna draw again. This is your esophagus. This is your oral cavity, esophagus, your stomach, right? And then your duodenum, right? And then your jejunum, right? And then you get ileum, yeah? And you got your ileocecal right here. That kind of ileum and cecum area, yeah? So this colon area, so this is cecum, and then this is haustra, okay? If you want to learn more detail. And descending colon, and then you get ascending colon, and then we get appendix, yeah? Descending colon, transverse colon, descending colon, you got sigmoid, you got rectum, and then you got anus, yeah? All right, we're gonna talk about accessories. Now right here, guys, when you see this, it's kind of, you see that your duodenum like C shape here, right? So it's like in between that C shape there is, what is this, everybody? Start with letter P. Everybody, what is this? Letter P. Natalie, you always answer fast and quick. Or Eric or David or Shifa, everybody, Daniel, what's this? Are you guys there?
Pancreas?
Yeah, indeed, David. Pancreas, yeah. Now and then you're gonna have something kind of here. Oh, we're gonna change different color. So what is this? It's kind of huge. What is this, guys? Kind of like that. Wait, I need to imagine what it looks like. Yeah, kind of. Not quite, but quite enough. What is this? That has so many lobes. So I'm going to, what's this, guys? This is a little bit better. What's that? Start with letter L.
The liver.
Yeah, good job. Now you see that between the liver, and then they kind of connect in the back here with duodenum, right? And also we have the pancreas here, yeah. Pancreas has a 3-part, the cauda and a 2-part, and the corpus, the body and the, 3, the body, the head and the tail, yeah. That matters. So if you have cancer in tail area, that's more dangerous, that's more life-threatening instead of tail. Now, remember I told you that from your mouth, there's a enzyme. So in order for the food to be breaking down into small, less particles, right? In your mouth, you chewing it, you with your teeth, right? You masticate, and different part of teeth kind of different function, yeah. And then your and then they go to the esophagus, and then when you go to your gaster, so it's, imagine juice. You cut the food into smaller, and then you're gonna mix that chemically, yeah. So mechanically you break down food, chemically you mix with the enzyme. So we need enzyme. That's why we have that enzyme peel if you lack of, right? So that enzyme is very important to break your carbohydrate, right? That turn into sugar, glucose, and then your protein and your fat. Now, remember I told you that they start chemically mixing the food of your protein and your carbohydrate, yeah, polysaccharide, disaccharide, monosaccharide, and then sugar, but not fat, yeah. So this is very important. Have you ever heard people say your health is in your gut? I believe that. Okay, go back to this, yeah. So you see here, this is the pancreas, and this is the liver, and then behind the liver, what is that? What's that behind the liver that many times we have to remove that if they're not, they get obstructed? You have your bile, right? So something like this, okay? And then they have the duct connect to your duodenum, yeah? Now, what does bile doing here? So your liver function like your kitchen, right? And then also they're functioning as a recycle system. So all the toxin goes to the liver, and then the liver will recycle them in this matter, bilirubin. Yeah. So your liver, so kind of like this, the liver. So your liver get that bilirubin. Where's that bilirubin coming from, guys? Anybody know? Bilirubin, where's that coming from? It's coming from your red blood cells, your erythrocytes. Yeah. Is your erythrocyte live eternally, or they do have life expectancy? Anybody? David, what's the answer?
Life expectancy.
Yeah, so how many days your red blood cells can live? 60 to 90 days, right? After that, they're dead. Yeah, they're not functioning. And that's what produce bilirubin. Yeah, bilirubin is the breaking up of the dead red blood cells. Or could be people have malaria. Malaria causes hemolysis, breakdown of your red blood cells, erythrocyte. Yeah. So that's produce bilirubin. Bilirubin is toxin. Bilirubin is not good. Bilirubin has to be released through the feces and urine. Make sense? So remember when you have a little baby and that baby's liver is not mature enough and you're born, and then all of a sudden the baby has yellowish skin, icterus, right? And then that's because the liver cannot recycle that bilirubin. Bilirubin causes that jaundice, icterus, yeah, yellowish. Make sense? So that bilirubin has to be eliminated into feces or urine. Now, the way the body works, when you give them waste, they don't throw the whole waste. We're going to learn that later when we learn about urine production. Yeah. So they don't throw them all. They recycle them. Yeah. And then they throw the waste. Yeah. We have so much waste in our country. I think they said a lot of food being thrown excessively. And ironically, we still have a lot of hungry person or homeless. Yeah. It's just to throw out idea there. So go back here, right? So the liver's function is to recycle. And then they will produce out of the bilirubin something that is still functional. Yeah. Which is called bile. Yeah. And then they're gonna put them in here, right? Okay. And then they connect to the duodenum. So when your food, your fat coming out of your gaster, they pass the duodenum, then the bile get released. So what is the function of the bile? Is to help breaking down fat. Yeah. So that's why when people has this bile duct and then a pouch not functioning, right? What happened when they poop? They defecate. You see that flooding feces because lots of fat in there. The fat not being metabolized or not being breaking down. Does that make sense so far? Now, if you see the pancreas here also, pancreas also release, they call protease. Yeah. I'm wrong, sorry. not protease. Protease is released here to break protein in your gaster. That's called lipase and amylase. Yeah. So that's why when you want to see the function of your one indicator to know your pancreas is healthy or not is by doing blood tests and to see the lipase and amylase. Anything you see A's, that's enzyme. Yeah. Now, what's this function? So when amylase release from the pancreas into the duodenum, yeah, amylase, they break down more of the breaking down of the carbohydrate or polysaccharide, disaccharide or monosaccharide. Yeah. And lipase is from the word lipid, which is fat. So we have two enzymes, two chemical ingredient in our body that help break down the fat. Yeah, because fat need to be broken down. Otherwise, they just pass through, and then people defecate and they eliminate, and then all of a sudden the feces is flooding because filled with fatty fat. Yeah. There's also medication used to be prescribed, now OTC called LE, if one of the diet medication. What it does is to prevent these two bile and lipase to be released. So the fat just pass through and then throw down. So you eat delicious food, right? Yummy food, but you don't want to get the consequence of being absorbed and then get into your blood vessel, and then you got high blood pressure, high cholesterol, and stroke, yeah, heart attack. They just pass through. Okay, so that's a little bit story about our digestive system. I think it's almost, what? It's just 8:10, guys. What time is your? Maybe we do half of so we can catch up with them. 7, 8, 9, yeah. So you guys can do your homework. All right, let's move on. Chapter 8, digestive tract. Now, some of the question that they emphasize here is not really from what I'm teaching you, but I think that's very important to know that basic knowledge about digestive tract, okay? That means okay because nobody say no. All right. Now we're gonna move to.
Thanks for putting away all that.
Oh, what? Seems like they jump in. We want to start from the beginning, but if we cannot, then we cannot. So we'll see. We shall see.
Thanks for putting away all that equipment.
Oh, never mind. So that's fine. Okay, we're gonna go to Shiva. Shiva, go ahead, take remote control and we just finish up this, yeah? And then we're done. Oh, Shiva, we cannot share
Hi.
to you.
Yeah, I'm on my phone. Sorry.
Yeah, I could tell. Ashley, go ahead, Ashley. Yeah, we're almost done, guys. Yeah. All right. Can you guys see that? What I'm seeing? I'm gonna check, make sure. Yeah. So Ashley, go ahead. Control the mouse. Are you there, Ashley? Eric, are you able to take mouse?
Unfortunately not.
Yeah, I don't see that. We're gonna go back again so everybody get their turn. We're gonna go back to Natalie. All right, Natalie, go ahead. Take over the mouse.
It was a huge help. I have something else for you now that you're done. Here's a set of new patient registration forms with medical terms that I'd like you to translate.
Can you
You
unmute
seem to be up
yourself,
on your
Natalie?
terminology, so I'll let you get started. If you
Yes.
have any questions, just ask.
Click continue. Yeah. All right, scroll down. Just click on the blue and then answer that. What? Oh, there you go. Yeah. Now swallowing, what is that? Phagy, phago. Yeah. So yes, dysphagia. Ia is pertaining to. Good. All right, I'm gonna be quiet. Yeah. Everybody. Good. Emesis is throwing up hematoblood. Yeah. Awesome. All right, there's more. Oh, redundant. Yeah, good job. All right, submit. After this, Lillian, yeah, get ready. Yeah, so one is gallstone. Remember the bile? It's called gall, yeah, the bladder, gallbladder.
Maybe this one.
Itis is inflammation.
Oh yeah.
Litho is stone, yeah. Cole is the gall. Good job. Good. Stoma is mouth. Zero is dry, yeah.
Oh,
Oh, it repeats again, huh? Good. Ah, we forget to submit, huh? Good. That's the EGD, yeah? Esophago gastroduodenoscopy. Some textbooks say esophageal gastroduodenoscopy, the same. Yeah. I missed that. I didn't see that. Yeah. What is dysphagia? Dysphagia is this painful. Phagia is swallowing. That's painful swallowing. So that's not the answer.
yeah.
Yeah, good. Page is swallow, arrow is air. Good job. Awesome. Good. Plastic surgical repair. Palato is your, yeah. Yep. Ileus. So we have ileum, ileus, yeah? Ileus is blockage in your large intestine. Good job.
I have one more assignment that I can use your help on by the end of the day. There's a set of patient histories in the system that needs spelling corrections.
So next,
Hopefully
Lillian.
this doesn't take too long. I'll check back with you in a little bit.
All right, give me the mouse. Okay, next, Lillian. All right, go for it, Lillian.
Okay.
And then Daniel after this, yeah. So this is during famine, children that don't get enough carbohydrate, yeah, we call cachexia. And if they're lack of protein, let me make a note probably, yeah. So it's a good note, yeah. So lack of carbohydrate, so this is in the poor area. So the disease in the poor country is lack of food. The disease of the rich country is excessive food. Yeah. So cachexia disease, they just don't have money, don't have access to food, and even the cheapest food, which is carbohydrate. Yeah. And marasmus, yeah. And sometimes they have both, yeah. So marasmus, cachexia is if you see the picture of children, hungry children, or people that only showing bones and skin. You can see the bones, you don't see enough muscles. That's cachexia, yeah. And then you see children with moon face look bloated only because the lack of protein. If you guys learn about pathogenesis, why? Because they lack of protein, albumin that allow the liquid in your blood vessel stay in the blood vessel. Yeah, that's called oncotic pressure. And then hydrostatic pressure is that what hold the water. Now, if they lack of albumin, which is part of protein, so all of those liquid comes out of the blood vessel and go to between cell interstitial, and they get bloated and they get edema, and that's because of lack of protein. Yeah. Maybe some of you never see this. I came from a country that still have a lot of poor people, and I used to work for World Vision and UNICEF. I've seen this a lot in my country, Indonesia, the poorest of the poor area. Okay, in case any of you interested to work, you can be healthcare provider, but you work in the nonprofit, yeah, Doctors Without Borders, ADRA, UNICEF. There's a lot, yeah. All right. Okay, there's a little bit notes. Now, it could be also cancer. You see that? Since diagnosis cancer, patient have cachexia because cancer just eat out all part of your body, right? Cancer just destroy. And you see cancer patient, they look cachexic. Had sigmoidoscopy 6 months ago. Lillian, can you read them all so you guys get used to all the term? Maybe starting from past medical history.
Past medical history had sigmoidoscopy 6 months ago because of millennia. Had surgery 4 months ago for colon resection and anastomosis.
Anastomosis, yeah, there's no U. All right,
Oh.
so yeah. So someone with liver cancer, right? Because of the hepatic portal get pushed with that with the liver cell that get fibrotic, and they will throw out blood and also blood in their feces. Yeah. So hematemesis melena. Yeah. I've seen that patient when they already have that and all the toxin from the liver get into the brain. That's pretty close to death. Yeah. I've seen Asian people quite a lot get this liver cancer. I've seen young patient died of that. A guy, 28, 27. Really sad. You're gonna see that big tummy and then cachexic, and they keep throwing blood. Yeah, hematemesis, and then their feces filled with blood too, melena. Okay. Oh, it's a divorced male, smokes 1 pack per day. What's the diagnosis? It's not there yet. Okay. Oh, colon cancer 6 months ago. Okay. All right, start from chief complaint.
Chief complaint, dyspepsia and aerophagia.
Mhm. Since you guys don't show your face, is that okay? I put this in YouTube, guys. Are you okay with that? Put in the chat if you're not okay. I do have a YouTube channel. Once a while, I would like to put some stuff there. And go ahead, subscribe and like button. I can't check your message yet because Lillian has the mouse. All right.
History of present illness, no GI problems until last 2 weeks. Patient reports the dyspepsia has worsened in that period of time with increase of flatus and burping.
What is flatus, guys? That's medical terminology. Anybody? That's farting, fart. Yeah. So flatus, you release gas in the bottom, burping gas in your mouth, right? So you see that dyspepsia and aerophagia. Yeah. So patient has past medical history of, oh, yeah, he had procedure, which is, I need to be quiet. Yeah. Awesome. So esophagogastro, they're still wrong. So this is endoscopy, yeah?
Open.
Wrong.
Wrong still.
Yeah. That's all I can say, okay? Everybody can help. Daniel, Ogler, David, Shiva, Ashley, Eric, Sitlali. It keeps showing. You gotta click ignore. Still check the stomach.
It should be an O instead of A for gastro.
Yes. Awesome. Yeah. That's EGD, endoscopy, esophago-gastroduodenoscopy. Good. It's a married woman. That's woman, right? Non-smoker, occasional alcohol use. Why do we ask alcohol use? Because alcohol use really destroy hepatocyte, yeah? Destroy the cell of your liver, right? So litho is stone, cole is your gal. Good. Awesome. No GI problem until last. Oh, the same question, isn't it? Oh, same patient, but different question. All right. Melena, 2 weeks ago. No complaints of. Click ignore all. Yeah. Yeah, I cannot remove that, bro. Whatever is it. There's a excessive letters there, yeah. Awesome. Good job. Do we have more? But wait, there's more. Oh, single parents are deceased. We don't know parent died of what. Hmm. So impression is like assessment, diagnosis, yeah. So cole is gall, cysto is bladder, yeah. Awesome. Inflammation of the gallbladder. Cholecystitis gut. Good job. And then we remove that, right? So combine chole and cysto and ectomy. Yeah. Click ignore all. Yeah. All right, good. Awesome. All right. You're gonna be hired.
This is actually very impressive. You've got quite a bit of expertise in gastroenterological terminology, don't you? Well, I try. Well, you succeed. It's a rare pleasure to see someone step into this with such a high degree of competence. Thank you. No, thank you. Your overall performance today has been excellent. As far as I'm concerned, we'd love to have your help in this department on a regular basis. That's great to hear. Take care and have a good night.
All right. Who's gonna take over this? David, okay. Oh, Eric is okay. Can I put this recording into YouTube, guys? Can you comment? Natalie, okay. Ogler, are you okay with that? Daniel, okay. Lillian. All right. Looks like everybody, huh? Shiva, is that okay? All right. Good, good. Yes, I'm okay. Thank you. All right, everybody. Almost. Yeah. Thank you. I'll put into the YouTube as well. You guys know where to see this recording, right? You just go to Zoom and then cloud recording. Okay. All right. David, let's finish this up and we're done. Okay. And then we continue with urinary system on Wednesday. So you guys can finish your homework.
Thank you. No, thank you. Your overall performance today has been excellent. As far as I'm concerned, we'd love to have your help in this department on a regular basis. That's great to hear. Take care and have a good night.
You're hired, guys. Good job. All right. Can you read that, Lillian? And then it's nice to see, to hear, and then to think. Yeah.
I think it's me who's reading right now.
Oh, David.
So this is the
Sorry,
clinical.
David. I thought it's Lillian. Yeah, go for it, David. Thank you.
Okay, this is the clinical description of the presence of gallstones in the gallbladder or bile ducts.
Okay.
I think it's this one.
Awesome. Good job. You guys are so smart.
A blank is the lack of adequate saliva due to diminished secretions by the salivary glands.
Awesome. Yeah. Cool.
The surgical connection between two hollow or tubular structures is known as.
Good. Wow. David, you work in healthcare or you've taken this class or?
I think it's just from the work that we did
Oh,
earlier.
okay, good, good. You're ready to be a doctor, huh?
When surgery is used for the removal of the gallbladder, this procedure is known as.
Easy peasy, mac and cheesy, lemon squeezy now, huh?
Mm-hmm.
Yeah. You can close your eyes and
If a
answer
patient has a
that.
sigmoidoscopy, she is having an examination of the
No, that's, yeah. It's giveaway question. There's a sigmoid. Yeah, good.
This tar-like appearance caused by the presence of digested blood in the stool is known as.
Awesome.
When a patient shows signs of vomiting blood, this is known as.
Yeah,
Mhm.
good job.
The action of swallowing excessive air while eating or drinking, a common cause of gas in the stomach, is known as. This condition is the partial or complete blockage of the small or large intestines.
Awesome. Yeah.
The surgical repair of a cleft palate, also used to refer to the repair of a cleft lip, is known as. This one.
Mhm.
This is a condition of physical wasting away due to the loss of weight and muscle mass that occurs in patients with diseases such as advanced cancer or AIDS. I think it's-
Good. Yeah, even their muscles get lost.
Patients that have difficulty swallowing are suffering from this condition. This one.
Good. Yay.
And a abnormal accumulation of a serous fluid in the peritoneal cavity is identified as. This one?
Yeah, ascites. So sometimes we have to drain them. Yeah.
When a patient is feeling pain or discomfort in digestion, this is also known as dyspepsia.
Awesome. Yoo-hoo, 100%.
An endoscopic procedure that allows
Endoscopic procedure, yeah.
endoscopic procedure that allows direct visualization of the upper GI tract is also known as this one.
Yeah. So in the clinic, we just call EGD, yeah?
Mm-hmm.
Yeah, good. Awesome, 100%, yay. All right, so we're done, guys. 2 chapters. Any question from anybody about anything? I'm gonna stop the recording now, yeah?